This is Life in a Border Town. I'm your host, Walter Patrician, chiming in here. The majority of the episodes produced so far has taken us back to the 19th and 20th centuries. Today's episode will focus on the historical event we are all currently living through, the COVID-19 pandemic. This is episode 8, Border Crossing Daily in Pandemic Times. I interviewed my dear friend, former broadcaster, and laboratory scientist in a Detroit area hospital, Edgar Chawan Martinez. We reflected on the last year and a half, and we focused on Edgar's perspective experiencing the pandemic unfold during his time commuting back and forth from Windsor and Detroit. This interview was recorded in June 2021 in Windsor, Ontario.
Okay, so yeah, my name is Edgar Chawan Martinez, as Walt mentioned. I am a cross-border worker working in the States. Fortunate or not, I guess, during the pandemic, have been crossing back and forth, working in the hospitals there as a laboratory scientist. So recently, I had been employed there for about a year and a half before COVID hit, and have been working throughout the pandemic, no time off in between. So that's my, I guess, background, working in several different departments in the laboratory. So COVID-19 testing, hematology, chemistry. And yeah, we're still dealing with it as we speak now, June 21st, still ongoing. But yeah, I'd like to talk about some of the things that have occurred during that time.
Yeah, like you said, we're still dealing with it. June 21st, 2021. I want to, and then disclosure, Edgar's my friend too. So we used to co-host a show called Del Cafe Pombo and CJM 99.1 FM in the early 2010s. So I want to take us back to a conversation. I remember this because we were talking it was March 2020. And I remember we were talking about 0 cases in Windsor, and you were telling me that there's absolutely cases of COVID in Windsor at that point. It was just not written down yet. And I was kind of curious what was going on, in your mind, kind of, seeing this play out at that point in March 2020.
Yeah, so I mean, a lot of it was my own I guess skepticism, my own, like me trying to predict what could happen. They were showing us mathematical modeling of like how it would look, how many cases there should be versus how many are reported. Also, just like on the sheer statistical side of it, you don't see a lot of testing being done. The sample size of testing that's being done is so minute. And this thing spread so quickly from what we were understanding about it. You were seeing, it was almost like day to day. I remember seeing kind of tracking cases going from, because I became a little bit obsessed with I think everyone did, seeing like, where is this thing coming from? What corners of the country? So like Washington, and then we saw it coming up. In Michigan, I think maybe there's only a handful of cases at the time. But basically, it's like you can hypothesize, or I guess extrapolate is the word I want to use, that if you are seeing one case plucked out, and we are aware that already at that point that there was like a lag in when things would manifest, and knowing in the hospital people aren't ever really tested until they are clearly showing symptoms, from what I understand. The fact that there were already people showing up with symptoms, and knowing how often we're crossing, the border is so intertwined, I was just certain that was happening on this end too, and it was just a matter of time. It's like once you see one case in Metro Detroit, it's just a matter of time before you're seeing it on our side. We're so interconnected.
And maybe you could also talk a little bit about, because, in January 2020, like China was hit bad, right? And then there was that moment in between where Italy got hit bad. So, did you even know back then, in the early 2020, before, like it was becoming extremely obvious it was going to be here. Did you see that, ultimately coming to this Windsor, Detroit region at that time, the COVID pandemic?
Yeah, I mean, what surprised me was how early, I guess, Metro Detroit was hit, and that's would be the conversation a lot amongst, people, a lot of which employees at my work are residents of Michigan. And, if we were going to, we expected it to manifest as in like you're seeing it in the coast. Okay, that makes sense. There's so much international travel and, New York City, New York State. But the speed at which it hit Metro Detroit was really astonishing. And there was a ton of speculation involved, whether it's, is it a lot of international travel because it's a automobile hub, a hub of industry for automotives, or what is it about that region in particular that made the disease spread so quickly? It's not particularly dense population wise. So that was really the baffling thing. And yeah, I would say no, I didn't, although I did feel that it was to some degree inevitable the way they were talking about it, that it would hit us eventually. I didn't think it would come at the speed in which it did. I felt like you could almost see it coming down the pike. And not to raise some kind of conspiracy alarm, it makes you wonder how long, maybe it was circulating for a while before we even fully understood what it was. And that's why it felt like it was faster than it is. But then again, we've seen it come and go so quickly too that maybe that's just how this kind of plays out. It suddenly cascades like snowballs into many, many cases, and then just as quickly as those people get sick and hopefully get better or have a negative outcome, it goes away in that time too. Like as the spikes are as they say, the waves are kind of, they're steep, So it does feel like boom, the hospital is full, and then we're back, we're good again, and it happens with that speed, and sometimes with no rhyme or reason. I feel to some degree, especially after that first bit.
So I'm gonna pull a quote from history because, of course, in 1918 the Spanish influenza hit our region too. And I was looking at this stuff, and it's kind of insane how uncanny it is. I've been saying this a lot, that history doesn't repeat but it rhymes. So I'm gonna pull a quote, and okay, this is gonna be from October 19th, 1918. And this is from one of the old Border City Star newspapers. But basically, it was talking about how movie houses, pool rooms, dance halls, theaters, and other places where crowds congregate were closed in Detroit as a health order. And then there was another article or another quote that I pulled from October 22nd, 1918 from the Border City Star, where one of our top doctors addressing the pandemic in 1918 was talking about how, so this is the quote, Dr. Cruikshank said that a distinguished scientist says that if everyone wore a mask, there would be no influenza in the country within a week, and he thought the suggestion was reasonable. So, it's kind of crazy because, I mean, like, of course, it's really hard to fathom. Like 100 years ago, this similar thing happened, but it did. Was there any moment where you went to history and just tried to pull some learning lessons of what the hell we were going through?
Yeah, absolutely. I mean, I think it was manifested too with some kind of YouTube algorithm that started to figure out that that topic is super relevant, even though it wasn't like new things were coming out about the Spanish flu at all, but suddenly it could have been my own inquiries, or it just started to manifest in the stuff I was reading. What was interesting is what I looked towards in that situation was, okay, obviously, like how bad can this get? how many people are going to be affected or ill. What did they do for treatments was a big thing that I was seeing, because I had also read that it was the deaths were because of mismanagement of, how they treated patients. And I was like, whoa, are we going to repeat this? Are we going to do better? Also, there's that optimism that, we've really come a long way in 100 years in medicine and just our understanding of disease, that we would have a far better outcome. And to some degree, yes, and to some degree, no. Like our short-sightedness, it feels like, and I'm speaking also for myself, not throwing, casting any kind of negativity towards anybody, but yeah, we are quick to forget, or we want to like pretend it's over. Like, we put it in the rear view mirror, like before it's way too soon. We've already had multiple moments of going like, yeah, this is gonna be okay, or we're past the worst of it, and then it just kind of comes full circle, comes right back. So I guess in terms of Spanish flu, yeah, the biggest thing I was like, okay, what's this timeline? I want to know, like, how long did it take them to get over? Because you don't hear about the Spanish flu anymore. And the reality was somewhat depressing because, okay, they say like roughly 2.5 years is when it was like really, really affecting people in a major way, and it kind of died out afterwards. But upon reading more about it, there was cases of a similar flu going into 20 and 30 years later, just in other parts of the world, and also we kind of to reflect on the point we were making earlier. If it took them that long to realize what was going on, how long was it already going on before they realized that it was, something to be worried about? Maybe that flu was circulating for, a few years before then. So it was, I guess, a source of comfort that we have recent recorded history. You know better than I, Walt, but the level of documenting, historical events from that time period, it's unique in the sense that, we have papers, we have all the access to stuff that people were saying, I guess, on the ground level, and not just in some history book from, people that we have no, words that we can pull from. So there is comfort in the sense that, okay, people got over it then, and we should do better now, because we should be smarter now.
Time to drink some tea. I like this mug, by the way.
Yeah, that's actually a gift from our other co-host, Tom Provost. He got that bird cup. It's got the, I don't want to say Canadian birds. There's a good mix of birds there. Blue Jay Cardinal.
Hey, Tom, this is a great mug. Got some... Yeah, this is great. Okay. So, yeah, and I remember, I just remember talking to you early in the pandemic, like we're, April, May 2020, and it was like, what the hell is going to go on? What is happening, And I guess, my question is, what was going through your head as you were, commuting daily into your work in Detroit?
Yeah, so it was, vivid because I worked, late nights, and we would have, some downtime to talk about, what was happening. And I started to become a little bit obsessed with checking the WHO reports. So every day, I guess I learned then, they would put out basically like a summary of what was going on in the world. And it's just like watching a disaster movie. They would put the little dots, population density dots around the world, and basically say like how this is spreading, where it's spreading. And then they gave recommendations at the end of every report, basically the level of danger that we're in. So like what they recommend hospitals to do. And then so it's really interesting to pull, actually, if someone wants to kind of study how our perception of the disease changed. That first month, the reports started going from, this is like a small scale problem to, suddenly recommending that people don't fly, recommending, lockdowns. And that slowly was upticking. And I was just obsessed with checking every day, like how quickly, because you hear about exponential growth. It's like, how quickly is this going to go, boom. Are we going to go from, a couple thousand people to a couple million to like everybody? I mean, we know exponential growth, like, it goes in that trajectory. And so the conversation started to become, okay, if this is, we obviously have to come to work. It's like the realization that if you work in a hospital system, you're not going to, get time off. So how are we going to deal with it? What's the day to day going to be? I'm lucky enough, and I, hats off to everyone who had frontline patient care. Like, my God, I can imagine the fear for those people who had families or older, loved ones in their home. And it became like, what's my game plan for how I'm going to go home every day? Like, what am I going to do? Am I going to, maybe not stay at home, maybe stay in a hotel? So all these things start going through your head. Are we going to, basically disrobe in a garage? I mean, I don't have access to one, unfortunately, so I kind of turned my cold storage room into like a different entry point. And then I bought a bunch of Head and Shoulders because I'd heard that extracellular zinc, I guess in a test tube, zinc kills COVID, and I think people have, thrown that around and ate zinc pills, and how much of that's true or not, who knows. Anyway, so you start to latch on to anything that'll give you some comfort, I think mostly mentally. So it's like, all right, this zinc shampoo, I'm going to use that as my body wash. I'm going to, change in the cold room and then run right to the shower every day. And I did that every day for like 4 or 5 months. And I told my mom, you know what, I'm not going to see you for a little while because like we don't know how bad this is. And from our perspective, I think we had more maybe doom and gloom just because you only saw really, really sick patients. That's just the nature of the beast. You only see the sickest people, and you only or hear about the sickest people. And yeah, I'm on the number side of it, so I see these, I guess, changes in people's, chemistries and stuff. And in a way, it's fascinating because it was like a crash course in one particular, ailment. But you're just seeing the negatives, and you can't help but get really, really, I guess, scared in some ways. Not for myself, but for others. And then there's the whole cross-border issue, which I know we can get into too. But the border is such being a border town, it's such a unique place. We're right beside a great city, big city, and then the fear started becoming, am I even going to be able to come back into the country? That started to become the conversation because I feel like a lot of people didn't want to have the virus, or people who could potentially carry the virus, come in and out. And it got kind of nasty, if you believe any comments that you read in the local paper. People, they're just like, they should stay over there. They chose to work over there, and we don't want them bringing this over here to us. When it turns out in the long run, healthcare workers were among the safer people because we, like any other airborne illness, nurses and doctors know how to deal with that sort of thing. We have the standard precautions, which turned out to be enough to protect you to a huge degree. If you, followed protocol, and sanitize properly and masks, that everyone adapted the mask and the, gloves policy, we were safe, and we weren't actually the ones, I don't think, bringing it over back and forth. I think overwhelmingly it's shown that they haven't. So, so I guess back to your original question, that our thought process when it started, it really was like, okay, are we just in danger being in the room? You started to wonder, like, is it coming in through the vents? Like, how contagious is this thing? Because I remember hearing about that church in Korea that had the big outbreak, and I think it was Vox or one of those sites, and they showed the spread of it, and it was like, it really did feel like if one person, according to them, had a COVID and the entire church got sick, it's like, oh God, like this thing could be, anywhere, everywhere. So yeah, it took a while. I wish I could pinpoint. I don't know if you remember. Well, I almost have to go back and look. Like how far into it did people start wearing masks all the time? And I don't even know when we started wearing masks at work. If that was like very recently in it, but it did become a source of comfort at work anyway. To be like, okay, now I feel like I'm somewhat protected. Whether that's they've shown to be true that it does protect you, but even more from oddly a mental health standpoint, although some people hate the mask, it was like, all right, I feel safe now. I feel safe. But that did take some time, I think.
I think it was March or April, but I remember the first time seeing a employee at Shoppers Drug Mart wearing a mask, and I was like, oh my God. And of course, in the news, I know there was an example of MTA employees in New York City where I believe their employer said, do not wear the mask. We're going to frighten people. And unfortunately, it led to a lot of sickness and death of those employees. So, it's... and then, of course, I know sometimes people throw the criticism onto institutions like the CDC for saying, oh, don't take the mask right now. Don't wear them right now because the healthcare workers, they need it, so don't, buy all the N94s or whatever. And then I think a couple months later they said, well, you can make a cloth mask at home. So I could understand from the public's perspective of this anxiety of what, why didn't they say that at the beginning? And one greatest takeaway from this whole year and a half or whatever is that, updates are happening every day, every week, and people are reevaluating. It's like, okay, we have a better idea now. So, we have a better understanding and now we're going to share this to the public, and of course, you're not going to convince everybody, like I literally got my groceries yesterday in the West End of Windsor, and there was a guy with a megaphone saying Kovacs is a hoax, Kovacs is a lie or something. He kept saying it. And that happened yesterday. So I think maybe if you wanted to maybe continue on your experience of seeing like in your workplace about seeing, because I know you were telling me there were moments where it was really a capacity or you're overloaded with the system, and then kind of how you were pinpointing with like it went really high up and then decreased. So
yeah so we, not to get into too much specifics exactly where I work, but I work enough of our base is from Metro Detroit, our patient base, a weird way to phrase it, but our patients. So it's a good actually mix of people who kind of live in the surrounding area and people from Metro Detroit, citizens of Metro Detroit who work there. So we are not a particularly large hospital. We're by no means like mega hospital. We're, fairly average size hospital to small. And I remember the big talk, and everyone was, I think, CNN couldn't stop talking about the ventilator issue. So that became like the metric, was like, okay, how many, vents are up today? How many do we have in the hospital? And I guess we were in the unique position from like the laboratory because we were small enough that we communicate with the respiratory therapists who work there. I kind of had like a running number in my head at all times at how many vents, because they would, that'd be one of the first things I asked them, like, oh, how are we doing on that? Or like, are we at capacity? And then the fear is, if we run out, like what kind of calls are you making? Because you saw in Italy all of those images of people who couldn't get to oxygen or ventilators, and them saying that that's when they had to make tough calls of who was, and that's a horrible thing to think about, that people are out there making calls. So from our perspective, I mean, we I remember hearing that we had to get vents basically brought from other campuses the in Michigan from our healthcare system, where places who were not as hard hit. So Metro Detroit was so hard hit, and like we were kind of the spillover of Metro Detroit because it wasn't Metro Detroit proper, that we were getting in vents. I remember hearing about that, and that was something that was like, oh wow, this is becoming. I thought this was going to be one of the hospitals now that was dealing with like the overflow and having to deal with those tough calls. Again, luckily it was like as it was getting like we're at the very tippy top of capacity, and other wings of the hospital I was hearing were turned into COVID wings, and plans on expanding or where they're going to put other patients. As that started to come around, then cases started to kind of drop, and I correlates with maybe the mask wearing, the fact that it was now, getting to be kind of better weather at the time. Now that I'm thinking about it, like the weather was starting to turn. We were hitting April, and people were spending more time outdoors. Maybe the spread was going down. People who would get affected the worst were already in the hospital. That our numbers started to go down. But again, it was something every day. It was. Our workplace would send us a report of basically our status, how many people were how many people were infected, how many beds we had, what our capacity was, and that way it became kind of like, oh God, you're watching the number, the spike go up, and you're waiting for it to come, like the roller coaster go down the other way. I mean, in terms of the early portion of it, I want to say that I felt safe in the sense that at nights we were like spread out and alone, and everyone was kind of like on the same page at first. At first, everyone's on the same page about it. This is a scary thing, and we have to come up with like solutions for it. Everyone, I feel like when they got on board with the mask, it was like, all right, we're all doing it. There wasn't resistance. Like the resistance came oddly afterwards. I don't know why it comes in waves the way it does, but it felt like that was certainly the case. It went from being like an absolute crisis, and then everything was shut down. And I think anyone has worked healthcare during that time would tell you all surgeries were kind of canceled. That became the main focus. People were also scared to come to the hospital to get their routine stuff done, to get their surgeries done. It became like, oh, this is like an infected place, so we don't want to go anywhere near that. And so in that way, it kind of cooled down everything else, and we could just focus on that, which is, a blessing in some ways. But I don't know. I guess I still can't I really don't understand why it happens in waves. But that's why it's like you can never let your guard down, I feel. Because just as the second wave, I couldn't put my finger on the timeline of it, but it was kind of the same. Never as bad, but I feel so relieved that it was never as bad, because that first little bit got really scary, and you saw like the looks on people's faces, like overworked, nurses, respiratory therapists, people. I remember a friend of mine at work, mentioning that he was not going to live with his father anymore because he didn't want to bring it home, and all of those things that people had to do at the time because we just didn't know how bad it was going to be. Those were now quelled, but as we stand today, we want to pretend that it's basically over. I think tomorrow, when we're on the 21st, the state of Michigan is going to lift all restrictions. So I think that means no masks anywhere are required, full capacity games and all that. And I mean, that's great in theory, but it feels like fast. Like just as fast as it came, it's going to just go. And I don't know if that's the safest route necessarily, but I get it. People are sick of it, and that comes back to that whole idea of our, like, I feel like we're short-sighted. It's like not until it hits us in the face do we go like, okay, now we have to make a change. And it's like, boom, all of a sudden. Heck, even the speed at which, like, we started getting testing and stuff done. Getting the kits and getting our protocols and them opening up I keep saying vaccination, opening up testing stations and curbside testing at my work. The speed at that, like the speed of bureaucracy out the window, and it was every day. It felt like you almost had a line from like the people making the decisions high up to like you're getting that email of what they just talked about, within the hour or so, because they wanted to keep people updated. So yeah, I don't. What do you feel about the whole thing, Walt? Like, what if tomorrow you walked in and nobody had a mask on? Because I started to see that in my workplace and driving through Detroit. Like, it's weird to see people's faces again.
It's funny because I was at one of the big superstores not too long ago. And I noticed one guy just walking around without a mask on. And that to me was jarring. And then, I was hearing something not too long ago about like, well, trust the science, like if you're walking around in a store or whatever, and everyone has 2 doses of the vaccine, of course, how do you know that? And then even heaven forbid, if you get it, like, what are you afraid of, So I do, and then it's just also really fascinating in real time, just seeing, like you said, with the Michigan example, people want to live. It's like, people have been saying over and over, it's like we lost this year of our lives, and like, I've heard of people like missing out these milestones. Like I have coworkers at the mass vaccination clinic I work at talking about, oh, I should have been married today, but it's postponed. And then this one girl I work with, she was supposed to go to prom, so she just took, pictures anyways on the riverfront. So, it's like I understand. Of course, my biggest fear too, right, is just, the number still doesn't really add up in terms of the vaccination. And of course, you're never going to convince that one group of people to get vaccinated. But how do you do so in a way that prevents like, where are we at in Ontario? 4th wave? We got to make sure not to get that. I think another fascinating cultural aspect of this was to find connection through video and stuff. I mean, I think like sometimes I think about the Zoom thing and people talk about video fatigue, and like I get it, I get that too. So it's just a very fascinating modern phenomenon that resulted from being isolated, right? We needed the next best thing to connect with each other. But that also seems like a chapter in the past right now, or at least it's like one step in the present, one step in the past. So we talked about, your experience going through these waves at work. Maybe you could talk about starting to see the silver lining of like, oh, holy cow, we're actually getting a hold of this thing, maybe the emergence of the actual vaccine.
Yeah. So there was different, I guess, metrics at which I would say that some positive kind of thoughts came into play. So one was, I remember the surface thing, everyone was so scared of surfaces touching surfaces. And that was the biggest, I guess, fear for us because, we weren't in direct patient care. We didn't have to deal with someone coughing on us or that sort of thing, but we ran the tests and we, dealt with test tubes and that sort of thing. So the first thing was like, all right, I used so much hand sanitizer. It was like drenched and I think everyone did. Bought one for their car, bought one for when you walked in the door, bought one for, for the pocket. So when it started coming out that, the CDC put out some studies that it wasn't affecting It wasn't being transmitted on surfaces, and then the different metrics again, which is like, oh, it lives on this long on cardboard, this long on steel. Basically, the bottom line was that you're not getting it from touching, things. Or as like contagious as we thought it was, which is like we thought you touch an item and then you touch your face and it's game over. Here you have COVID now. So that was the first step to quell our fears, and they did a study basically putting everyone in categories of, direct patient contact versus people who, less and less, and then they basically put you in a group, how much and how little patient contact you had. So that was the first thing, the fact that we didn't have to drench ourselves in antimicrobials, and then seeing everyone adopt the mask, and then the first wave kind of drop, the summer coming, and everyone doing better, and taking to walking and taking to outdoor activities, finding alternatives, as you were saying, to meeting, and figuring Zoom out and all that stuff. So there were for sure positives in that. So the silver lining coming, you kept hearing about, and maybe we won't even delve into this part, but that the vaccine was promised on certain dates by certain people, right? Like, I guess politicians. And then the date, that can would be kicked. The skeptic in me was like, vaccine's not going to be out for, maybe 2+ years, because most other things take a long time to roll out. And I know a lot of it is bureaucratic. A lot of it is just constant peer reviewing and not being able to do human testing for a very long time, where in this case all of that stuff was lifted and people were volunteering because they felt like a sense of duty to be guinea pigs for the vaccine. So that all changed really quickly. Man, though, was I surprised when, beginning of the year, it was like within a couple weeks, it was like, okay, the vaccine is ready for use, and now, boom, here it is. Like, you're allowed to get it now. I was, just blindly optimistic in the sense that I was like, I'm excited to get it. Everyone's going to be, just as excited to get it. And if people aren't, I want to be such an advocate for it, or, first in line to kind of prove, hey, look, I'm fine, and hopefully convince people in my, social circle or whatever to go like, yeah, this is safe. And in a weird way, it's that sense of, I guess, not duty, but if you trust the science, put your money where your mouth is and go like, yep, I'm getting it right away, no hesitation. So yeah, when that came around, it was like, all right, then it was the waiting period of, okay, let's see how long it's going to take to get to the rest of the public. And still, again, sitting here in June, it's not something that's readily available to everyone, although I know we're getting pretty close. But I felt safer for myself, but it didn't feel like it was truly over until everyone I think I knew was vaccinated, because then it was like I still felt like this weird potential carrier, because now I am able to do more, but I still have to restrict myself. So now it's the next battle is kind of convincing the remaining few, or maybe they never will be convinced. I have my own personal kind of projects in terms of convincing people of things. But, it became oddly political to talk about anything related with the mask, and now the vaccine. Those are intertwined, and somewhat like spiritual too. Like that, there's a component of that we don't talk about, because a lot of faiths have said one thing or the other about the vaccine, and we don't have that language. I think with, I guess, the youth, or I shouldn't say language, dialogue between like the youth and the older generations, and how they view, I want to say even modern medicine, or they view what the vaccine rollout was like on a global perspective. So that's the next battle. And the other thing is, and not to bring this up, but like they're talking about third doses now. And, as soon as they start talking about it, it starts manifesting. How long before we start going, oh, and again, this is a giant experiment. We're going to go like, oh, shoot, people are getting sick again. I guess the immunizations only last so long, and we haven't put our fingers on how long that really is. And that was actually, funny enough, a conversation I was having yesterday, which is that's the next step in this. We're going to figure out, we're going to do great in the summer, short-sighted, oh, it's over, it's fine. Winter's going to roll around, that's going to be hitting around that 1 year mark of when the majority of the first wave of people were vaccinated. That stuff's going to start to wear off. And now what is it going to look like? And now let's do it all over again. Let's do the dance all over again. Are we shutting everything down, or are we just going to go, hey, you're on your own now, guys. The vaccine's there. Get it if you want. Get a third, fourth, fifth, as many as you want. But it's on you, citizens of the world, because the government's not going to do anything about it anymore. Ball's in your court.
A really fascinating, and it makes sense, fact is that if let's say, U.S. majority is vaccinated, Canada majority is vaccinated, UK, whatever, and we got the rich countries vaccinated, and you still have a lot of countries that are not vaccinated. It's no matter what, this is still going on, this pandemic, and then just from the nature of watching this thing start, really, probably there's even traces back in, late 2019, but the nature of the 21st century, people freely visiting cities, other cities around the world. Maybe you could talk a little bit about this. It's just, what are the implications of a world that only the rich countries are vaccinated, and it's still taking a long time to vaccinate places like India, for example?
Yeah, that's just the sad part about it. And I guess that when I said the religion thing earlier, that's what I was thinking of, other places in the world where they have a different view of a vaccination, or they don't have the resources. But there's many, epidemics that you hear about in the world. Some of it is partly due to the fact that, culturally, it's not a normal practice to get vaccine, or you're going to have to convince people to get the vaccine. I don't doubt that that's going to be a hurdle, because even in our own countries, or modern countries, the rich countries, quote unquote, there is a percentage of people who feel like, for whatever reason, it's not the right thing to do. So, and the reality of this virus, and again, we don't understand the nature of it, because the Spanish flu came and went. Maybe this will come and go. We don't know. But in terms of how it spreads, we do know that it's pretty contagious. And even if there's 30% of the population circulating with the virus, that are susceptible hosts to the virus, that means it's going to thrive. It's going to survive. It started with one, right? And it spread to so many people. So as long as there's one person who's a carrier, and we're not all fully immune, and I don't know how well this vaccine's going to do, the time will tell on it. We have to basically focus on every single person in the world. And now, you've heard about stuff like them extending expiry dates on vaccines because they can't give them away fast enough, or again, the bureaucracy starts to bog us down now, which we were doing well with at the beginning, and this is how we got the vaccine so quickly in the first place, it seems like. But then it becomes, they're turning away vaccine here at the border. They're trying to come up with unique solutions for the vaccine at the border, getting it in the middle of the tunnel. I can just imagine the hurdles that international affairs bring when you're having to transport vaccine and keep it at negative 60 degrees, bringing it to Africa and India. Japan even was still at a low rate of vaccination because they have their own, and who knows the reason really, but I've heard that they had their own process to basically approve it, and it took a long time. And look, they're opening up the Olympics there. So, yeah, until we start hearing that there's no cases anywhere, just as much as it was started from one country and spread all over, I'm not going to feel completely safe until I know that the whole world is blank percentage immunized, 80%. I don't know. I can't put my finger on it, but yeah, we almost have to, we live in our own bubble. Like we live in our own reality and we see everyone around us is vaccinated, so we think, okay, yeah, it's all good. No problem. But this thing has no face and it has no borders really. It travels where we go and there are no borders for us, as a species, quote unquote. Like we travel everywhere. So I think that's the frightening part. And this is what the analogy I was trying to tell somebody else. Like, you can really only be an advocate for yourself or protect yourself against this, because like depending on your government to do everything for you, or like to keep the borders closed forever. I mean, that's a pipe dream. That's it eventually is just gonna give. Like, we're gonna open everything up. So if you're not on top of your own health and safety, your own immunity being up and getting healthy for yourself, like, we can't expect the world to be shut down forever. And basically, I think the role of the government was like, look, this is why I think the grip is loosening, because like, what could they do? They got to us to the point where the vaccine is now available, and the rest is kind of on us. They can't restrict your freedom and stop you from traveling forever, and people are going to travel. There's so many of us with so many different, things going on in our lives, families who live abroad. You can't stop that forever. So it's here until we get everyone in the world a vaccine, I think. That's the reality. And as depressing as that reality is, I think it's probably a good exercise to just think of it in the most doom and gloom scenario, where it's like it's around for a long time, and we do better, suddenly, okay, it doesn't feel as bad. Again, Walt, I know that we talked a lot about in previous conversations, vaccine hesitancy and that sort of thing, disinformation. It's so prevalent, and it goes back to like us being in our own bubble of media, being in our own, we live in our own news feed algorithm, so we're just constantly fed our biases all the time, and the vaccine is no different. Like, what's going to be the thing that, like, where's our source of objective truth on this? Like, for me, okay, checking scientific websites or, articles or CDC, like, yeah, that's all well and good, but it's not something that's palatable to most people, and even me to some degree. Like, no, I don't understand some of the stuff that they're saying, or I'm just taking them at face value, and I don't feel like there's this arbiter for truth. Who's gonna save us on that front? I don't know. Who's gonna stop the vaccine hesitancy in that way? Maybe we just can't. I wonder though, like, there had to have been skeptics in the early days, of the Spanish flu too, right? Although there was never a vaccine produced, as far as I know.
I got to do my research, on that part. I plan to add a little bit of that to this recording. But yeah, I can't talk about 1918 skeptics nor vaccines. But I mean, what you just said, I'm always going to think about this one project. I believe it was the Washington Post that did this, but it's a really simple project. And all it is that it's, they simultaneously show you two different feeds of like someone's social media. So someone who identifies as conservative in the United States or Republican, and then the other for liberal. And then it's interesting because they take like topics like the 2016 election, and then they see how they write about each other, right? And that's what you said about the echo chambers or whatnot. And then, even just kind of, if it's even possible to take a step back from this conversation we're having right now, I mean, there might be people out there that are thinking, well, look at these guys in their own echo chamber thinking, the WHO is factual, and, all of these scientists who back the claim of these effective vaccines. And then I think I found myself throughout this whole pandemic thinking, well, who do I trust with my life? Like an epidemiologist, like I trust science, So like for me, it kind of that helped me clear the path towards finding trust in this scary pandemic. And of course there's going to be folks that doubt that too, but it's like, well, that you have to have a foundation in what you trust, and of course governments can get it wrong, of course, and even scientific bodies and whatnot, but it's like, that's why it only helps if you cross-reference other scientific bodies, like for example the local health unit. Like I listen to their health reports. I'm like, okay, great. Like it helps me keep in check. I guess that's what I'm trying to say, And is there any last words you wanted to say?
Yeah, I guess just I wish everyone the best, and hope, good luck to everyone having those conversations with their family members. And I'm also saying this for myself: be understanding, be patient with people, and be patient with one another as things open up too, because we're gonna act kind of funky. Some of us are gonna try to rush into it too quickly. We might be standing in a grocery store and not social distancing, and be patient and considerate with one another. And again, I say that to myself because we all have a family member who maybe isn't on our same page as us, but look, we have. Again, we don't have this source of objective truth. Maybe we never did. So we have to kind of be each other's guide through this, and you do that through being understanding, not, and again, I'm saying this for myself, not forcing things down people's throats. Yeah. So thanks, Walt.
Thank you. Thank you again to Edgar Chawan Martinez for the interview. Thank you for listening. This is Life in a Border Town. Stay safe out there.